Hi, I'm Dr. Senthamizhan from Athreya Hospital. Today I will discuss about a topic known as colon surgery. First of all, we should know what is colon. Colon is a part of your gastrointestinal tract. This gastrointestinal tract will start from your mouth till it ends. That means the food entry up to the food exit will come under a category known as gastrointestinal system. In that part, the last part of the gastrointestinal tract is known as colon. Colon is nothing other term known as large intestine. Large intestine is the area where your almost all the digested food will get settled, and most of the water or reabsorption will be taken from the stool, which will be converted into the stool, which can be excreted to the anus. What is colectomy? The part of colon or a whole segment of the colon is removed, it is known as colectomy. Why the colon removal is done for you? Colon removal is done for various different conditions. The most common condition for which the colon is removed is colon cancer, followed by IBS. IBS is nothing but inflammatory bowel disease. There are two types of inflammatory bowel disease. One is known as Crohn's disease, the other is known as ulcerative colitis. What are the different type of colon surgeries available? Colon surgeries are divided into two things. One is complete colectomy. That means apart from your starting of the colon to the starting of the anus will be completely removed. This is known as total colectomy. There are few other term known as hemicolectomy. Hemicolectomy means either a part of the colon will be removed. Hemicolectomy is again divided into right and left. Right means the right side of the colon, if it is removed, it is known as right hemicolectomy, whereas the left side of the colon is removed, it is known as left hemicolectomy. The different type of colectomy are: first one, polypectomy. Polypectomy is nothing but it's just a snaring of the polyp which is located in the internal mucosa of the large intestine. It is done through a colonoscopy, and most of this procedure almost polypectomy is done under sedation. It doesn't need any anesthesia. Second thing is, as if I already explained, hemicolectomy. It can be either right or it can be left. Third thing is total colectomy. Total colectomy is done in as central large incision is made and total colon will be removed. And minimal invasive colectomy, it means through the laparoscopy the part of colon which has to be removed, either left or right, or a segmental part of the colon has to be removed. It can be done to one minimal invasive laparoscopic surgery also. Colon surgery is removing a part of your colon which is a part of your gastrointestinal tract. So recovery will be depending upon three stages. First thing is immediate post-operative. In post-operative for first 3 to 6 weeks, and then for after the next 6 weeks. First week of the surgery means, that means first week of the surgery, one thing, three kind of things has to be managed. First thing is post surgery pain management has to be done, which will mostly be done by the doctors by giving regular pain management like painkillers and advising you to the proper mobilization. Third thing is post surgery, if any wound is there, as a doctor has to take care of the wound so that it is not getting infected. Regular proper IV antibiotic, proper medication and proper regular dressing also can avoid the wound healing. Regarding follow-up, whatever surgery as patient has undergone, follow-up play a major role in the recovery from the disease, because post surgery patient physical part of has been removed. So patient should understand a proper follow-up post surgery is always going to recovery phase going to be very smooth. What and all follow-up, what and all things patient has to do during follow-up: a proper regular USG scan along with the urine routine to just to check whether the urine flow is normal or any kind of minor urine infection is there. Third thing is proper PSA monitoring. PSA monitoring indicate whether the surgery has gone in smooth way and also give us an idea whether the condition is recurring or the treated condition like cancer is recurring, or the recurrence rate, if it in the initial stage, can be avoided or not. So proper follow up with a regular blood investigation along with the simple ultrasound scan will give the recovery space so smooth, and it will always help to avoid or detect the recurrence in very early stage so that the treatment can be done smooth and in a prospective way. patient has to be conscious about starting the diet. Most of the patient who is going to colon surgery, initial few days can be kept in NP, will be kept in NP, means nil per oral. Patient will not be eating anything, but it will be managed with the IV fluid and other medication which is under the control of the doctor. Post surgery, maybe on the day 3 or day 4, initially patient will be advised taking the liquid diet, means clear liquid diet like juices, like water, followed if the patient is able to tolerate and this patient is able to defecate properly, then it will be changed into very soft diet which can rather in few more days can be converted into normal oral solid diet.